According to the Parkinson's Disease Foundation, approximately 60,000 Americans are diagnosed with Parkinson's disease each year. But is there a link between Parkinson's and depression? ABC 7's Alex Redmond has more. Alex?
Thanks, Haley. Parkinson's disease is a chronic, debilitating illness, currently without a cure. The progression can leave a person unable to control their movements. Normally, it's possible a diagnosis can propel a person into depression. But for those already suffering depression, it can be far worse. But there is still hope. 76-year-old Rick Richardson says there were signs and symptoms.
I had developed a bit of a tremor in my hand, an arm, when I tried to eat. And my handwriting had never been great, but it was now terrible.
He displays only some symptoms of Parkinson's and not others.
You know, you're falling. You know, ratchet movement means it doesn't move as easily, swings freely as, and I freeze quite a bit.
Freezing, he says, means when you come up to a threshold of a door or even walk up to a chair, you momentarily lose the ability to walk forward, and you just stand there.
And sometimes that leads to people doing this little tap dance like thing, like half step, shuffle around to get to the chair.
Richardson has Parkinsonism, which causes a combination of movement abnormalities seen in Parkinson's disease. He remembers getting the diagnosis.
It was actually, you know, a bit overwhelming, yes.
Symptoms aren't the only thing that can trigger depression in Parkinson's patients. Brain chemistry changes occur, including a reduction in serotonin and dopamine, which both affect mood.
People get sad, they get pessimistic, they get depressed.
But some are more vulnerable, says psychologist Dr. Angelo Domingo of Parkinson Place.
If someone has depression before they get Parkinson's disease, the depression is probably going to get much worse.
But with medication and lifestyle changes, there is hope.
This disease may require you to do things differently, but it certainly does not mean you can't do the things that you used to do. And once people learn that, and they no longer feel helpless, the depression lifts. I see it every day.
Patients with both Parkinson's disease and depression can be helped with antidepressant medications that increase the amount of serotonin in the brain and dopamine in the brain. And there is locally help at facilities like Parkinson's Place, which is a multidisciplinary care center dedicated specifically to those with Parkinson's disease.
And Alex, what are some of the exciting treatments that we have for Parkinson's?
We have deep brain stimulation, which is for those specifically that are not on too many medications and are extremely symptomatic. And I think that we actually did a story on that. It's very exciting.
We actually just ran one just earlier in our newscast today.
Oh, yeah. It's very interesting. And the other thing is there's functional cranial release, which we'll probably cover in the weeks to come. It's actually very exciting because it treats a lot of other things as well from a lot of other diseases.
All right. Thank you.